Good morning. Today at the World Implant Expo, we have Dr. Dhruv Arora. Sir, kindly introduce yourself.
Hi, I am Dr. Dhruv Arora, MDS Prosthodontics from New Delhi, and I am a key opinion leader for Point Implants.
And what are the topics would we be covering today?
We are going to talk about the new innovative technology of ultraviolet radiation on the implant surfaces. That is what we are going to discuss about.
So why do we need these UV activated implants and what are they?
See, this is a newer technology which has come up to improvise our success. By irradiating UV on the dental implant surface, we get good photofunctionalization, which means we are going to reverse the surface charge of the implant and attract more bone towards it.
So what are the benefits of these?
The major benefit is early osseointegration, so that our patients don't need to wait for teeth and they can get the final prosthesis within a period of 2 to 3 weeks.
So how is Point UV different from all the prevailing implants?
Point UV has got a very superb patented technology wherein it has a sealed ultraviolet radiation mechanism. You don't need to open the implants like in other cases. You can put the entire package into the activator and you can activate up to 32 implants at a time.
Sir, so all these implants, they come in a packed state. So why do we need to irradiate them?
See, the implants undergo a process called as biologic aging. Like we age, the implants also age. And once the implant is manufactured, that aging starts immediately the day after. So whenever I am incorporating that implant into my patient's mouth, I would like to use this sealed UV mechanism to reactivate, to reverse the aging. All of us don't want to age, right? So the implants also don't want to age. To reverse that, we require this step, which is very important.
So, sir, some of the implants are already coated or they are preserved. So, shouldn't that be enough?
Yeah, you're right. That is also one way of dealing with it. But the only problem is when these implants are preserved in a liquid, like Straumann implants, they come up with these liquid dipped implants. They just increase the hydrophilicity, the wettability of the implant. But they're not acting on the antimicrobial part. They're not acting on the, the surface charge treatment. So all these things are going to be combined when you do a UV radiation.
So, sir, in medically compromised patients like diabetic patients, how do we deal with it?
See, this is a very regular problem. More than 50% of geriatric patients are diabetic now. And with these diabetic patients, osteoporosis, lack of vitamin D, we are striving to get more bone contact with an implant. The moment you radiate an implant with ultraviolet radiation, it kind of pulls the blood towards itself. That is the reason we call these implants as vampire implants. They just start pulling blood and bone towards themselves.
Is there any scientific data or literature available on
Lots and lots of data. Studies have been happening since last 20 years now. And now we are also conducting studies in the Asia Pacific region, specifically in Indian bone and Indian patients.
So what is the effect of Point UV implant on the formation of bone?
See, that is what these small UV radiation implants with 15 seconds, 20 seconds do not actually get activated within this period. So Point UV implant is a very long, slow cycle of cleaning the implant, right? And that is going to majorly integrate the implant with the bone and pull the osteoblasts, which are the bone forming cells, towards the implant surface very, very quickly.
Sir, so you just spoke about short implants. So how do these UV activated implants work on these short implants?
See, that is what I was discussing, that the time period for which we radiate an implant with UV is very, very important. There are so many studies done in Japan and US, they indicate 4 hours is the minimum time required when you are anti-aging an implant. And 15 seconds, 20 seconds, 40 seconds, they do not do justice to this, the effect of ultraviolet radiation. That is the reason we are looking at a system which is giving me a lot of implants which are UV activated at the same time. So if I'm doing a full mouth surgery with a 15-second, 50-second cycle, I take out every implant, put it in the UV chamber, then take it out, put it in the patient's mouth, another implant I should take out and keep waiting for the UV to work on that. So that is the part which can be totally avoided when I'm using point implants.
Okay. So how about like what is the process of this irradiation?
See, it comes with a UVC radiation, which is around 290 nanometers, and it is a closed box which can accommodate 32 implants. And just before you place the implant in the patient's mouth, we are supposed to take out that implant from the activator.
So do you have any surgical guide which is available on the placement?
Yes, of course. We have a beautiful navigated system called as Point Navy, wherein you can do the entire planning on their software and you get a surgical printed guide. With a guided kit, you can go in absolutely flawless.
So, sir, is Point UV implants only in India or is it like in other countries?
Point Implants is a very old company. It's almost for 13 years into the industry and has captured a lot of market in the US, Argentina, Turkey, Syria, and a lot of other countries. It's just been launched in India, and most of us, I am already doing cases, and most of us are looking forward to this technology, adapting it into our routine practices.
So, talking about the torque, the force that is required, why is it less than 40?
This is a very beautiful question. The implants companies, they come in and they tell you that you can go up to 75 NCM, up to 100 NCM. That is okay. The implant will not fracture at that kind of torque. Their implants are good, that's fine. But ultimately, it is the bone which has to integrate with the implant. And if I'm pressurizing the bone a lot, I'm ultimately going to cause necrosis. So if I block your hand from here, there is no blood supply. Yes. There's no blood supply, it's going to go numb. That is the reason we advocate to keep it less than 40. And with 40, you can also do an immediate load. That is the beauty of UV.
So these are the torque for implants. What are the torques for abutment that you can use?
So we have a complete range of abutments with us, starting with the digital components, with the tie bases and custom abutments. So all these components are available. You can choose any of the prosthetic design on your patients, and we have a solution for it.